is a disease which is one of the most quickly spreading disease around the globe. The number of people suffering from depression is increasing day by day, all thanks to the changed lifestyle, which leaves very little time for a person for himself or herself. The major reason which is attributed as per allopathic texts for depression is that a hormone called serotonin is lesser the serotonin, the more the chances of a person to feel depressed. Or we can say that serotonin can be called as the hormone for happiness as per the allopathic texts are concerned. And as a result, the majority of the medications which are being given to patients suffering from depression are selective serotonin reuptake inhibitors, and those category of medications which help to maintain the level of serotonin in the brain. Then, as is pretty much evident, those medications are having lots and lots of dependence, and also the recovery which occurs in patients is only a partial recovery. If we talk about Ayurveda, the basic definition of a healthy person in itself covers the depression. It is said, Sam dosha, sam agnishcha, sam dhatu mal kriya, prasanna atma indriya mana swasthe itte vidhiyate. It means that if a person is to be healthy, Ayurveda covers the happiness as atma indriya mana swasthe itte vidhiyate. It means that if a person is to be healthy, Ayurveda covers the happiness aspect of the same. And there are lots many things in Ayurveda, some of them being guidelines in the lifestyle, some of them being dietary changes, and some of them being herbal combinations, which if used in a proper way, a depressed person can lead a very happy life. Starting with the lifestyle. When we talk about lifestyle, Ayurveda believes that a person should sleep early in the evening. It should not be late at night. There is a simple saying which we all have been hearing since childhood. Early to bed and early to rise makes a man healthy, wealthy and wise. But none of us is following it in today's world. We generally sleep late and we generally wake up late. If a person is suffering from depression and he wants to come out of it, this is the first thing which a person needs to change. Sleeping hours need to be earlier and the wake up time needs to be earlier. When I'm telling about these guidelines, majority of patients suffering from depression will have a common question in their mind, that we try hard to sleep. What if we are unable to sleep? Now that is something which is our duty. We, with the help of our herbal combination, can make you fall asleep pretty early, and that also we are not going to give you anything which is going to induce immediate sleep. Rather, we are going to give brain nourishing and brain relaxing herbal combinations, which if taken regularly helps the body to come to equilibrium, so that the body in itself, as per the biological clock, guides you to sleep, and then as per the biological clock you are able to wake up early in the morning. And rightly saying, our biological clock is tuned in such a way that our body demands rest and sleep pretty early, you can say at around 9 or 10 in the evening, and then our body tries to make us wake up around 4 or 5 o'clock in the morning, early in the morning. So once you start taking those combinations, it automatically starts toning up the biological clock back to the normal. So the first lifestyle change recommended is early to bed and early to rise. And if possible, if you are at a place where you can see the rising sun, it's very important for you to wake up early in the morning and see the rising sun, because those rays, those red rays of sun, rising sun, increase the level of serotonin in our body, increase the happiness quotient. So this is the first change. The second change is about diet. Whenever we are eating anything, a major chunk of the blood supply of body goes in the abdomen, in the GI tract, to digest those foods. And when the body is pushing up blood towards the GI tract, the rest of the parts of the body for those time periods are deprived a bit of the blood supply. It means that the digestion of a particular foodstuff that is being taken, the more time it is required by the body to push in blood supply towards the GI tract. As a result, the foodstuffs which are tougher to digest rob the brain of nutrients for longer time period. And that is why if a person is already depressed, we need to rejuvenate the brain, we want to nourish the brain, and it becomes all the more important that the foodstuffs that are being taken are pretty easier in digestion. Simple carbohydrates, simple proteins. Avoid taking complex carbohydrates and fats especially. Because if you take them regularly and already you are a patient of depression, the depression will further aggravate. So that is the second thing you need to change. Now the third thing, whenever you are sleeping, we require more blood to go inside your brain. So try raising the foot end a bit. You can use this kind of bed with 2 bricks or anything towards the leg side, so that the bed becomes a bit slanted like this. So that when you're sleeping, more and more blood is going inside the brain. That is the third change we require from your end. Now the support from our end. We over here provide a patient with Medhyara sign. In Charak Samhita, thousands of years old, it has been said, Mandukh Parnaya Swarasa Prayojya Shiren Yashti Madhukasya Churnam Raso Guruchastu Sa Mool Fal Pushp Khalu Shank Pushpaya. That is, a combination has been mentioned over that time, which if taken can bring the working of the brain to the optimum and can get all kind of depressions away from the person. When I'm talking about depression, in Ayurveda it is encompassing all the major psychological disorders like obsessive compulsive disorder, schizophrenia, mania, bipolar disorder. All such disorders I am talking about over here. This Medhyara sign has been mentioned to give benefits in all such diseases. And as a result, we have developed combinations, adding all those Medhyara signs in them. So that if a person is taking them regularly, slowly and gradually, the person starts living a normal life. It's not just about serotonin. Serotonin is one thing which has been researched by today's world. There are multiple other things mentioned to as Bhutagnis in Ayurveda. In Ayurveda, hormones are mentioned as Agnis. So there are various others which are yet to be researched. But with the usage of these ancient combinations, all those Agnis of our body can be normalized. And gradually, the person can see the change coming his way. The patient can see that yes, now I am living a much happier life. Be it the mood swings which occur in a bipolar patient. where sometimes the patient is aggressive or other time the patient feels depressive, or be it regular depression of any grade. These mirror signs work miraculously in all such patients. And that is why we have been using these mirror signs in our combinations along with recommended lifestyle changes. So my sincere best wishes to you all that change your lifestyle a bit and use these combinations only for some time period so that you can then visualize the change coming your way. And last but not the least, meditation. If you can meditate, do meditate, because if you meditate, the changes will be very, very, very quick to come, and then the improvement will be very quick to come. Do meditate, follow the guidelines, and use these combinations for some time so that you can lead a much happier and a depression.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma.
Redefining Ayurvedic excellence. Dr. Navdeep Sharma, a true Ayurvedist and a staunch believer in nature's healing power, treated thousands of patients suffering from chronic ailments. Not only a healer, he is also a contributor and keen researcher. Representing India at the British Parliament. Working in collaboration and sharing ideas with global personalities at the British Parliament. Participation in 4th Svashtha International Conference on Ayurveda and Integrative Medicine at Middlesex University. Paper presentation at Middlesex University, London. Interactive TV program at World Ayurveda Congress 2018. Telecasted at famous TV channel Care World. Participation in the first International Ayush Expo at Dubai. Arogya 2017. The first international exhibition and conference on Ayush and wellness. Being felicitated at Ahmedabad for his valuable contribution to promote Ayurveda.
Creating new benchmarks. Participation in Interfix 2018, New York, USA. Participation in the 8th World Ayurveda Congress. Delivering a thought-provoking talk on depression at a conclave in Expo, California. Felicitated during Indo-American Wellness Conclave and Exhibition. Dr. Navdeep Sharma and Dr. Monica Sharma invited by Juice Punjabi, New York. At their head office. Association with Ministry of Ayush, Government of India. Honoring Padma Shri, Shri Hans Ratans, Member Parliament.
With Yoga Guru, Baba Ramdev, Patanjali Ayurveda.
Felicitation by Dr. Anup Jain and sharing valuable thoughts at a Dhanwantri Jayanti Samaro, New Delhi. Speaker panelist on Ayurveda and Wellness Industry at Ayurveda Expo. Felicitation by Dr. Rajesh Kumar Singh at Ayurveda Expo. Visit of renowned politician Dr. Ratamjit Singh Basra at Risht Pusht, Amritsar Centre. Visit of esteemed ex-Health Minister Lakshmi Kanta Chawla at Risht Pusht, Amritsar Centre. Dr. Rakesh Sharma, Director Ayurveda, Government of Punjab, at Risht Pusht Mohali Centre. Dr. Navdeep Sharma with Sri Sudhanshuji Maharaj, a global spiritual leader, motivational guru and the founder of Vishwa Jagriti Mission. On air on CNN News 18. Giving COVID solutions to Indian community through Tez News. On air on Aaj Tak Tez. The most sought after panelist and educator on prominent International channels. Regular daily telecast of interactive show on international TV channel Juice Punjabi. Regular daily telecast of interactive show on national TV channel Disha TV. Invited to represent Indian Ayurveda against allopathy. On India Ahead channel. Dr. Navdeep Sharma, live, in Northeast on famous national TV channel on Times 24. Newspaper accolades. Indian-Tibetan Therapeutic Exchange Camp 2008, regularly organizing camps with Indian Army, Ayurvedic camp. Holding regular philanthropic free health checkup campaigns. Regular Ayurvedic shivers. Regular guest speaker for DGCA. Organization of yogic camps in various parts of the country. YND Karnaragam Private Limited. We provide research-based treatment in all sorts of chronic ailments. My promise to patients. My beliefs. Academic credentials. Our media associates. Certificates of qualifications. Welcome to ND Karnaragam Panchkarma Center. Another indoor wing of Naturopathy and Panchkarma. Now operational under the able guidance of Dr. Navdeep Sharma. Our dedicated team.